Back Talks. This is Dr. Sean McWilliams. Happy Wednesday to you. If you are here, there's a good chance that perhaps you're either trying to keep your spine healthy, learn more about it, or you're suffering with chronic and perhaps debilitating neck pain or low back pain, and you just don't have the quality of life you want, and you don't want to have surgery, and you don't want to live on drugs. So if that's you, and especially if you're a mom, you're at the right place. So we want to talk about today understanding the real reason why people get spinal pain and start to have dysfunction in their body. And a lot of people don't know the science behind this. So I'd like to share it with you. I think I woke up last night and just had this kind of aha moment after having a conversation with one of my good friends who came to see me having some health issues. And so he could connect the dysfunction that he was having that didn't seem to make sense, that it might have been coming from the nervous system in his low back. So I want to show you how that works, because I want you to understand that for yourself, because it's imperative to understand how our bodies work. Okay, so let's talk about that for a second. So, when we look at the human body, it is our nervous system and nerve function that controls every part. When there's no interference to our nervous system, it can control us in a healthy function, and it controls virtually every single cell, tissue, and organ system inside the body. There's 11 different organ systems inside the body. Our bodies are made up of 50 trillion tissue cells. When next time you're out for a walk and it's dark and you're looking up at the sky and you can see the Milky Way galaxy and you can see all the stars, what most people don't know is that our Milky Way galaxy is only made up of 100 billion stars on average, and yet our bodies have an average of 50 trillion tissue cells. Every single one of them having to be directed by the human nervous system, either through a physical nerve fiber or a chemical messenger. So it's imperative for us to be healthy as human beings, that our spinal column is as healthy as possible, to reduce the maximum amount of interference to the nervous system and pressure on the nerves, so our brain and body can communicate effectively at a very high level, because that's when we have expression of health. And if we get away from that, we're going to wind up getting some form of dis-ease or disease in our body. So I'll show you this chart, because this is exactly how our bodies work. So one of the things that we have to understand is we have to understand that there's 5 components of a subluxation. And when I say a subluxation, what I mean is that when a bone gets out of its normal position and starts to pinch or compress a nerve or nerve fibers and starts to interfere with the ability of the nerves to transmit the message or signal from the brain to the tissue cell and back. It's kind of like when you go through the drive-through, and the drive-through, like walkie-talkie system isn't really working good, and so it's like it breaks up, and you're trying to order and you get frustrated, right? And the person can't hear you, or they get your order wrong when you get up there, and so nothing wins. Imagine doing that with 50 trillion cells inside your body. That's the exact same thing that happens inside of our body. We want that communication to be crystal clear, and for that to happen, there's some things that need to take place inside of our body, especially in our spinal column. So let's go chat about this. So there's 5 components of a vertebral subluxation. Remember, vertebral subluxation is when a bone gets out of its normal position, it pinches or compresses the nerve. And remember, you will not always get pain with that. Most likely you won't until the end stages, so please remember that. People always go, well, if the nerves were pinched, wouldn't I have back pain? No, that is not the case in most of the time. Not until it becomes a chronic issue for you. And the reason is that the majority of the nerve fibers, there's millions of nerve cells inside this one nerve branch. They're motor nerves. Their job is to control your organs and your skeletal muscles, not be signaling pain for you. So that's super important to understand. So let's talk about this for a second. So the first cause of vertebral subluxation is called spinokinesiopathology. Now I know that's a really big word, but I'm going to break it down. So spino meaning spine, kinesio meaning the ability for the spine to move, and pathology means a disease of. So it means a disease of the ability for this to take place so that the nerves don't get pinched or compressed. So that's the first thing that happens, and most people don't realize that that happened to them. Your little baby learning to walk falls 50 times a day on average, and hits their chin on the coffee table. Maybe cries for a minute and you think everything's okay. Your kid falls at a sporting game, gets a tough tackle, or just continuing micro macro traumas, people that go out and run a lot. boom, 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 like that. These are all micro traumas. Sometimes they become macros. A bad fall skiing. I mean, obviously the list can go on and on. Abnormal, poor posture, poor sitting habits, poor ergonomics is a big one. And believe it or not, mental and emotional stress and chemical irritation can do it as well, can make these lose their proper segmental function. So that's the first thing, but most people never feel this, the spinal kinesiopathology. What happens in stage two? Stage two is neuropathology. Neuro meaning the nerve, pathology meaning a disease of. So a disease function of how the nerve is trying to communicate between the brain and your tissue cell. That's not good. We don't want that happening. We want 100% communication in our bodies to all 50 trillion cells. So we don't want neuropathology, and a lot of times though you don't know that neuropathology is happening. Where do most people start to notice this? Stage 3 and 4. Stage 3 is myopathology. Myo meaning muscle, pathology meaning, again, disease of the muscle, and we don't want that. So, but a lot of people go, oh, well, I just think it's muscular. That's what my buddy said to me yesterday when he came over, and I was just like, no, it's not. You're in the third stage already if you started noticing that of this. And the muscles contract because your body's innate intelligence that resides in our nervous system and our brain that controls every part of our body says, hey, there's damage here. There's pathology here in this part of the nervous system. Let's splint it. Let's put a cast around it. How's it do a cast? It contracts and spasms your muscles. That's what it does. So that's when, so most people go, I think my back pain, is just because of muscles. No, it's not. You're at stage 3 if the muscles are contracted. You got to realize the hierarchy of this. So this is how it works, okay? And then if you don't take care of it there, then you go into stage 4 called histopathology. What's histo mean? Histo means cell. So now your cells are dysfunctioning because of the lack of communication between either one tissue cell and another through the wires or the nerves or your brain and your cells. And if that doesn't get corrected, eventually what you're going to wind up having is you're going to have pathophysiology. Patho meaning dysfunction and pathology or disease of an organ or an organ system. And this is one of the major ways that we get disease in our body. So remember, if you're at myo or you're at histo and you're starting to notice changes in organ function and also the muscles, you're at stage 3 and 4 already. So I don't want that to happen to you, okay? So, getting your spinal column checked is really important. If you're suffering with back pain and you have imaging, I would love to look at those for you. If you're looking for a new solution to managing the chronic pain in your neck and low back without surgery and without drugs, I would love to help you because that's why we created Disc University. But I want to show you this chart again really quick, just for a minute, because I think it's so imperative to understand this. So this is how our nervous system functions. And many things can impair your nervous system and interfere with its function, like we just talked about. Mental and emotional stress, chemicals that you put in your body, such as prescription drugs, over-the-counter drugs, alcohol, any sort of medication. Could be environmental things that we're breathing. If you work in an environment that's very dirty or dusty, guys that spray cars all the time are around chemicals, painters, carpenters, all that kind of stuff. There's lots of chemical irritants that can really interfere with our bodies. And then physical traumas, poor posture, poor sleeping habits, slips, falls, strains, automobile accidents, all that stuff. So those are the 3 main categories that can create subluxations or spinal kinesiopathology and start this whole process. So how does our nervous system work? Because a lot of people don't make that connection. So let's look at it here. So we'll start up here at the neck or the cranial neck area. The cranial plexus, which is the nerve branches right up there at the top, look at where those green lines go. Blood supply to the head, scalp, bones of the face, brain, base of the skull, eyes, ears, eustachian tubes, nose, sinuses, mouth, tongue, vocal cords, tonsils, neck muscles. Go down into heart and coronary function, your esophagus, bronchial tubes, diaphragm, stomach, pancreas, spleen, kidneys, colon. That's a lot of parts of our body, right, that are controlled just from the upper part of our nervous system. What if we come down into the neck or the cervical plexus? And the plexus is a group of nerves, just to keep it easy. We go into your scalp, base of your skull. Again, a lot of people say they're always tight up there. Neck muscles. We go down into your diaphragm. That's the muscle that controls our ability to breathe. C3, C4, and C5 create what's called the phrenic nerve. The phrenic nerve controls the ability for the diaphragm to contract and pull our lungs down and suck air into our lungs and also let it relax. Vital for normal function and stamina is that diaphragm works properly. If we go down into the brachial plexus, that's going to be shoulders, elbows, arms, hands, wrists, fingers. If there's dysfunction in those, we want to go look at the nerve supply coming off the bottom base part of the neck. If we go into the sympathetic ganglion, those are branches that run down along the sides of the spinal cord. It's like an elevator shaft. You know, you ever get scared, like someone shocks you, and you get goosebumps, or you feel that sensation go all the way up your spine. It travels through these like elevator shafts so they can go to all different levels of your body, which is really quite fascinating when you study it. But that can control whole parts of your body. If you go into the celiac plexus, now you're going into chest, gallbladder, so people gallbladder issues, liver, diaphragm, stomach, pancreas, spleen, kidneys, small intestines, uterus, appendix. That's a lot of big body parts, that are controlled by this area of the mid-thoracic spine. If we go into the lumbar plexus, the yellow nerve branches, now we're going to large intestines, buttocks, groin, reproductive organs, your bladder, colon, upper legs, thighs, knees, prostate gland, lower legs, sciatic nerve. And then if you go down into the red, the sacral plexus at the very bottom part of your low back. Now again, buttocks, reproductive organs, bladder, prostate gland, sciatic nerve, lower legs, ankles, feet, arches, toes, and rectum. This is how our bodies work. It doesn't matter what kind of doctor you are, where you went to school. This is Anatomy 101, how our nervous systems work and how the brain and central nervous system control our body. What happens when there's compression on these? You start getting histopathology, cell dysfunction, which can lead to pathology and to pain. So if you're suffering with stuff like that, especially if you're already to the point where you're starting to have chronic pain, and you don't want surgery, you don't know which direction to go, I hope that you will take a chance on yourself, really, to be quite honest with you. Invest in yourself. I don't really like a chance. I want you to invest in you. And my girlfriend and I were just talking about it the other night. You know when you're on an airplane, you got to put your oxygen mask on first before you put it on your kids. Why? Because if you pass out, you can't help them either. And you're no good to anybody. So give yourself permission to take care of yourself first. All right? And one of the ways that you can do that is stop worrying and book a call with me. When I was in full-time practice, this was $197 I charged for a 15 to 20 minute call with a patient, with the type of care and information we were able to exchange with them. I mean, it takes decades of information and turn it into minutes for you to guide you. That's what I want to do. You can book a call with me, and right now, because my mission and my dream is to help people all around the world suffering with chronic back pain and neck pain be able to manage the majority of those from the comfort of their home and the safety of their home with just some right guidance. And that's why we created Disc University, because I was so tired of seeing people getting unnecessary surgeries and patients around the world that were only being told that surgery was their only option. I just saw it last week. I just got off the phone with someone from Hawaii the other day, trying to help this lady's father. And that's what everybody tells them, and that is not the case. So if you're being told that you need surgery and that's your only option, I want you to get on your computer or your phone right now, and I want you to go to booking.drseanmcwilliams.com. It's right here on your screen. set an appointment up with me. You'll see my calendar. You'll be able to fill out a little form and let me know everything that's been going on, what you've tried, imaging you've had done. If you have imaging, I want to look at that for you and give you a second opinion on it. And let me tell you, if I think surgery is the option you need, I'm going to be honest with you, I'll tell you to do that. I have sent people for surgery. But I'm going to tell you what, 97% of my patients over 25 years of full-time practice, I can probably say I've sent people 3 of them for that. And unfortunately, the people that came back after that weren't doing so great. And then they came back to me saying, hey, how can we manage this naturally? It's just how it is for most people. I have some great friends that are surgeons, so please, they do an amazing job, and there are times and places for back surgery. So please don't think I'm bashing on it, but it should not be your first option for managing your chronic pain in your spine. It should be like option number 7, 8, or 9. So please don't let it be number 1 and get bamboozled by someone that's telling you that. Please book a call with me so we can chat. I guarantee you, you're going to be glad you did. You're going to learn a lot about your body and your spine. I'm going to give you some hope and inspiration that there's a very good chance after we talk that yes, you probably can manage this. And if not, I'll be honest with you too, and I'll tell you that you can't, and I'll tell you what to do though. So no matter what, you're going to win. Okay, so do it. I only see 5 to 6 people a day when I do it because I like spending time with you and guiding you and inspiring you and giving you hope again, because that's what we're supposed to be doing. This is the vision that God gave me. That's why I semi-retired to do this and help people all over the world. And nothing gets me more excited than put another pin in this big map that unfortunately you can't see. But if I probably turn my camera, maybe you can. And get to see, let's see if I can do this without unplugging everything. Okay, so you get to see some of the behind the scenes here. All right, pull on my cables, but I have a massive map of the world right here, and nothing brings me more joy in my life right now than being able to help another person like you and be able to put a pin in and realize that I'm having an impact in the world and helping you change your life and get back to the quality of life that you love. So this is what I do. I want to help you. So go book a call with me. You're going to be glad you did. And then no matter what, you'll have a new friend and a good resource for you. But I guarantee I'm going to share some stuff with you that probably no one has and help guide you and help you get over this back pain and neck pain and get back to your life. So booking.drshawnmcwilliams.com. Take advantage of it, please. Used to charge $200 right now because I want to spread this message around the world. I'm doing it on me. I'm paying for it for you, so you got no excuse. All right. Great to have you here as always. I love and appreciate you. Please reach out to me. I want to help you. And take care of yourself first and give yourself permission to take care of yourself, okay? Nobody can do it for you. Unfortunately, you have to do it. So get on your computer right now, get on that link, book a call with me, and let's chat. All right? Love and appreciate you. See you guys next week.